Hey y'all, let's talk about 5 reasons why Black pregnant women in the US are dying at alarming rates. I'm Dr. Fatu Forna. I'm an OBGYN who works to keep pregnant women safe here in the US and around the world. So we all know that the US doesn't do a very good job. In fact, we do a really bad job of keeping pregnant women and especially Black mothers safe. Black women are 3 times more likely to die during or after pregnancy than white women. The US has the highest maternal mortality among industrialized, developed countries. And unfortunately, we are the only developed country where the maternal mortality rate is increasing. So let's talk about the 5 reasons why this is happening. Number 1, racism. The US has a history of slavery, discrimination, structural inequalities that affect Black women more. Chronic stress from generations of all of those issues actually affect the health of Black women, makes changes that can affect their health outcomes. Let's be very clear, though, that this is racism, not race, because we know that race is not a real thing. It's not a biological thing. It's a social construct that people just create depending on where you are. So racism is a big issue. Number 2, worse social determinants of health. These structural inequalities that I'm talking about, they cause and they affect our social determinants of health. The conditions where we live, we work, we play. It affects our ability to have safe housing, transportation, our exposure to violence, the job opportunities we have, good income, our nutritious food, all of those things, can cause Black women to have poorer health. It causes us to have high-risk conditions like obesity, hypertension, and diabetes. And what happens when you have those? You have poor pregnancy outcomes and you're more likely to die during or after pregnancy. It also makes Black women more likely to be poor, more likely to have difficulty getting insurance, more likely to live in a place where they might not have access to the best hospitals. So all of those things affecting our outcomes. Number 3, sexism. The US does not prioritize women's health, period. Just doesn't prioritize women's health. We can see by some of the laws that we have. First of all, we don't have universal health care. Where everyone has access to insurance. A lot of developed countries have it. A lot of developing countries or lower and middle income countries have it. We just don't at the US. So also reimbursement is less for women's health. Urology, things that, take care of men, anesthesia, ophthalmology, things like that are reimbursed much more than women's health. Medicaid, which is, a lot of, especially Black women, the majority of Black women are covered by Medicaid for delivery. Well, Medicaid doesn't reimburse well. And a lot of doctors and health systems discriminate against Medicaid, which causes difficulty for Black women. Some of the doctors just don't even take Medicaid. So all of these laws have problems and efforts to fix this. We actually have laws to fix this sitting in Congress. There's something called the Omnibus just sitting there, hasn't been passed because we're not committed to fixing this issue. Number 4, poor quality of care. So even when Black women can find care, they get insurance, they get care, the quality of care they receive is less. They're discriminated against. They're more likely to be dismissed when they have a complaint, to be ignored by their doctors and nurses. And the sad thing on top of that is that wealth and education doesn't protect you. A Black woman with a college education is still 1.6 times more likely to die during pregnancy or after pregnancy than a white woman with less than a high school education. A Black woman with a college education is 5 times more likely to die than a white woman with that same college education. So those inequalities just really go deep. And then finally, number 5, poor postpartum care. Medicaid, which I said most Black women, about 60% of Black women have Medicaid coverage for pregnancy has poor postpartum coverage. Slightly over half of all maternal deaths happen postpartum after you've had the baby. Well, Medicaid, has poor coverage. It ends at about 6 weeks in many states. There has been efforts to expand it to a year in some states, and many other states have signed on. Others just haven't signed on. Not very interested in fixing this issue. There's less maternity leave in the U.S. compared to other countries around the world. The U.S. Is the only industrialized country. When you compare us to Canada and France and the U.K., we are the only country that does not have paid maternity leave. We have 0 weeks of paid maternity leave, and this is what happens if you're not paid. You don't take the leave, and a lot of times people have to go back to work even when they're not ready or not healthy. Postpartum care, we do a very poor job of postpartum care compared to other countries. Other countries have midwives who do home visits. They check on women for complications to make sure they're not depressed, to support them. We just don't provide that kind of social support. So many issues, these are just 5, but Black women, I'm gonna be talking about these issues and sharing how we can fight to survive and thrive during and after pregnancy. So make sure to like this video and to follow me on all the platforms. I'm gonna be talking a lot in the upcoming days and weeks and months. All right, bye.